Bonsoir les femmes et les hommes. Ce soir, tonight we are with Mescal Hornbeck and we are talking about a subject very important and subject that we will all have personal experience with someday. And this subject is on death. And Mescal Hornbeck will answer questions. For many years she has been a nurse and she will give her own introduction. And we will first be introduced and then talk. Mescal?
Thank you. This is a very unexpected experience. I would like to say it right off, firsthand and immediately, that I am not a specialist in this area of dying, but I have been a nurse since 1928, and I've had a good many contacts with death and dying, and I've evoluted into a position from one of being absolutely frightened of death. At the age of 17, death was, let's put it frankly, scary and unknown, and at the age of 71, which I am now, I have come the whole gamut, and I feel much differently about death and much more comfortable in this topic than I ever dreamed that I could be.
Why do you think you are more comfortable with the subject of death?
Well, through the years, I've had experience in watching death, and being a rather introverted kind of a person, I've thought a bit about it. In fact, I've thought a great deal about it, and I feel it was sad that I had gotten to the age of 17 without having ever had any opportunity to discuss this topic with anyone. I'd heard it in church, and I saw things die, other animals. I've only seen one death in my 17 years, and it was a taboo subject at the time I was growing up. People did not discuss this. They didn't discuss birth either, for that matter. So I came, as I drove into the School of Nursing, where I was about to spend 5 years in a program of nursing in college, and the first thing that I saw was a hearse pulling out of the driveway with, of course, a body in it. That really gave me the shivers. Thank God for the fact that many people have many experiences in many areas where they can become acquainted with this process. But I feel that it would be great if more teaching was done, more objective approach was taken to death and dying in childhood, and it was taken as naturally as birth is.
What does it look like, a typical month's death? What does death look like before the person is going to die? What does this look like? What does the person look like, or what is the physical experience?
When people are dying slowly, as they have all, I have never seen any sudden death except in the movies, and I've heard about it, but I've never seen very many people. There have been near very many people who died suddenly, which of course is quite different. But people who have been ill with a terminal illness, an illness which is bound to result in death, at the time they become in the dying state, which we call moribund, there are changes, physical changes, which we were really taught that as students. The changes that herald the approach of death are circulatory, that is to do with the circulation of the blood, and with the breathing. And when death is imminent, let's say within several hours, there are notable changes in the circulation of the extremities of the body. The parts become pale to bluish, especially under the nail beds, and that is of the hands and the feet. The body's temperature, too, at the extremities is lessened. However, frequently their body, the central body, is hotter. I suppose it's because as long as your circulation and life, the heat that's being produced all the time, as long as you're alive, simply stays in one place and it doesn't get spread out. I don't know the answer to that. But that isn't very noticeable. The noticeable thing about the person's mental state, as far as I can see, is that they usually they withdraw less and less from the world around them, although many of them respond well, and I've experienced dying of people who stayed very alert right up to the very end, and actually there seemed to be no change in their mental powers. But most of the people who die simply fade out. That's my experience in observing it. If there is a condition which causes pain and discomfort, my philosophy is that if anyone would be uncomfortable if they were wide awake and alert, they should have all the measures possible taken to alleviate this discomfort. They should be they should have water in their mouth, they should have moisture in their mouth because they become thirsty, and I suspect that if a person is dying, they would still be thirsty if their mouth was dry, so we try to keep their mouth moist. They would be uncomfortable in an uncomfortable position, and as an abnormal position, or in a position where they maintained over a long period of time, so their positions should be changed. There's not much point to trying to feed them a lot of food because they can't swallow very well, they can't digest it very well, and it's pointless. Although I notice that many people put a great deal of emphasis on whether the person ate, and they seem to feel if somebody ate a bowl of soup or a bowl of cereal, that's great, that heralds their revival, so to speak. But actually, if you're moribund, your body, your intestinal tract is not functioning. You are not really able to cope with food, and it's quite immaterial at that moment. But I do believe that it's good to be able to have your mouth moistened and swallow if possible to alleviate a thirst. And it's also important for a person who is moribund. They can't swallow and they can't cough, and we do help get rid of the secretions that accumulate in the throat. Now that they should be cleared out. Are you able to cut this? That the secretion should be cleared out by moving the patient over on their side using a suction, bulb suction, or whatever suction equipment is available, but allowing them to have a free air passage so that they don't have to suffer the feeling of strangulation. Now, there is one point that I would like to make relative to people who are dying. Relatives and friends are very much concerned by the sounds that people make. They moan and they groan and they make strange noises and they have rattling noises. And many times relatives and friends feel that it's pain they're suffering, that these sounds come because of pain. I'm convinced that there is very little relationship to a great many of those sounds and pain. Many older people, very elderly people who are not anywhere near danger of dying will make strange sounds when they get old and their respiratory tract doesn't work very well. They take little short breaths and they do it with their mouth open. They'll come out and they'll sound like moans, and it'll sound like calling, and it will sound very strange. I've just realized from the fact that I am very close to an elderly lady that this is happening, and if someone asks her what's the matter, she doesn't know that she's even making the noise. She's so deaf. And with a person who is unable to cough, as I said, or swallow, there's a great deal of gurgling kind of sound, as you would have yourself if you had a little fluid in the back of your throat. And then you'd also find yourself making noises if you were breathing shortly and rapidly with your mouth open, or you had become half asleep. There's things like snoring, and then these keening sounds. I'm not going to try to emulate them, but I do feel that a great much of the sounds that the dying people will be making have nothing to do with their psyche, nothing to do with the way they're feeling about things, but simply the fact that their respiratory tract isn't working normally.
Do the people you have observed seem to be afraid of dying when they are dying?
That's one of the things that I've observed, and that they don't seem to be when they come to the point when it's actually happening. I see very little fear, actually, in dying, and I see very little pain associated with dying. Now, that's not true, of course, with a person before they become moribund and when they are facing their terminality of their condition. They can be in a panic then, but when the chips are down, they don't seem to be afraid. It just seems very peaceful to me. And that is a concept or a feeling you won't get unless you do see some people die. But if one time comes and you must observe a loved one die, look at it closely, objectively, not subjectively, and I think you'll see what I have been seeing, that this is true.
Does everybody feel this panic before a moribund? I mean, have you seen a person without fear before the moribund?
Oh, I've seen so many people that are able to face the whole of life because they know what it's all about, and I'm thinking of many people who have faced it very bravely and philosophically and were able to take it so well. When they say about somebody, he lived well and he died well. Of course, if you die suddenly, you don't have any chance to practice or demonstrate that, but the person who's faced with something like cancer of the brain or some other condition, I can think of a woman that had that, and she stands out in my memory. It was in a hospital as a person who really faced a fact. She just accepted it. It was talked about. It wasn't any mystery. That's the second thing that I think is very important, is that people not be unaware of the fact that they're dying, and that there be no attempt to play games with the living or with the dying on this subject. I think it's a tragically cruel thing if a person has a condition which is terminal, that they don't know it because there may be a lot of things that they want to think about and do. And instead of playing games and everybody pretending everything is great, making a foolish facade of the whole thing, so that the person can't comfortably die. They can't get off their chest what they want to get off. They can't have somebody around them helping to do it. It's always a big game. Oh, you're fine today. Isn't that great? You look so good. And well, am I going to get well? Oh, sure, you'll be out of here in a couple of weeks. These are the kind of words that don't jibe. It's not a healthy attitude. I'm afraid we Americans, well, perhaps all people do this. I don't know, but I don't like to see it. I see more problems arising from it than I do solutions.
How can we prepare ourselves for our own death?
Can you shut the thing off now? I'm sorry, but how we can prepare for our own deaths would include the things that I have just gone over previously, and that is that we should be helped by our parents and our school and our society to look at the process of death as a part of living, so that it isn't a truly alien, frightening, scary thing. Now, I was lucky because there weren't any immediate deaths that affected me personally, but if I had had a close friend or a closer relative than the one that did die, I would have been devastated. As it was, at the time I was 17, with nothing to back me up or shore me up. I started by being with strangers who were dying, people who I had known before. And it's devastating when you watch it. It's very devastating to be around the families, I will admit. But it could have been a lot easier if there'd been some realism in my background on the subject of death. Well, there wasn't any realism on the subject of life either. I mean, of being born either. So I guess I can't complain too much. It's probably true of many, many people that grow up. But I think the avoidance of feelings of fear of death, of the physical process of death, is very much more easily overcome than the problems of worrying about what's going to happen to your soul after dying, and perhaps that's what bothers a good many people. My answer to that is it's a personal one, but I think that the churches, and I think the ministers and the rabbis and so on, have a responsibility to do a better job in preparing people for dying than to make them feel that if they haven't done haven't believed such and such a thing, or they haven't done such and such a thing, there's going to be some horrible punishment to it. I don't believe it myself. In fact, the problem with me is, my good friends, I'm not convinced of afterlife in the sense that most people think about it, as a wonderful perpetual opportunity to grow. I think of afterlife as a spirit that will exist, commingled with other spirits. I don't anticipate myself beyond the grave. And I'm not afraid of death from the standpoint of whether my sins, and I have sins, that could require a lot of retribution if we had a God who was going to request retribution. And I don't believe my sins are going to be punished, and I don't know that my good points are going to be blessed. Period.
Can you just talk about what death looks like once it has happened?
Well, it doesn't look like the TV pictures. I've never seen anybody go wildly off into the air, clutching their fingers. Mostly the people that die simply become inert. Their mouths are open. Their eyes may or may not be open. The color changes rather rapidly within a short while, and of course they do become cool in a very short while. And the word is fully relaxed, completely flaccid for a while before they start to become stiffer. And that the discoloration can be marked with many, although most adults don't show a terrific amount of discoloration immediately after death. So if family was with people who were dying, they wouldn't be too noticeable, nor would it be too devastatingly frightening or macabre, I would say. That's it. This thing called rigor mortis, which is the Latin name for death stiffness, occurs within a fairly short time, and from our detective stories on in the books and movies, the doctor, the pathologist, can get a pretty good idea of how long a person's been dead by the rigor mortis, time the rigor mortis has developed. But they look very natural. They don't become. Usually the expression is perfectly benign because all the muscles that make for expressions are relaxed, so there's no special expression on a person's face when they've died. And it isn't as gruesome, it isn't as frightening, it isn't macabre, it's just a natural process. I think, to tell you the truth, when you watch the birth of a baby, there are more things that seem a little bit, well, unusual or strange about it occur with the birth of a baby than there does with dying, because the baby looks all warped and strange, often a very strange color, very puffy. There's blood, and the baby's usually crying and sounding pitiful. And so if you weren't so happy about the fact that the baby got born, you would probably be pretty appalled at the way everything looks. But that's not true with death. And it's a job that people do by themselves. I will have to say this: we have a good many people who are frightened to death of being alone because they're afraid they'll die. And I'm 71. I don't mind a bit being alone. I don't mind a bit being alone. I wouldn't mind a bit being alone when I died, because I'm alone when I die, and so are you. It's a job we do by ourselves. It's very nice, and it's very wonderful. And I think the idea of the hospice concept of having people somewhere where there are people around that love them, and a modification of the rather starchy and stiff regulations in the hospital, making it possible for people to be around them all the time while they're dying, is very important. But when it comes right down to it, the dying process is done solo. There's nobody but you doing it. And, well, I have one more idea if there's time. And this refers to hospitals, to hospital care. That I realize that I can only be in one place at a time, and I haven't been in too many different hospitals. But there's a great deal of difference in the way death is managed from one hospital to another, by one nurse and another. And it tortures me to see a person who's ostensibly moribund and I have seen this happen, being put to torture, so to speak, by people rushing in, doing cut-downs to put needles in their veins, putting cannula in their noses so that they'll get oxygen, putting gadgetry on to help them breathe, when at this time they should have peace. They shouldn't even be tortured for bathing and things like that. The only thing they need is comfort. It's nice to take care of body secretions. You wouldn't want them wallowing in that, but there's no reason for torturing a person when they are ostensibly moribund. I mean, and I do realize that some nurses haven't been taught apparently this, and they think the great thing to do is to keep them living for a little while longer. Maybe it's only going to be a matter of an hour or two. Maybe it's going to be a week. But I don't want that to happen to me. I want to be able to die with dignity, and that's what that means to me. Not having somebody poking me, putting me in a room where my relatives can't be, so they can do all kinds of procedures on me with the effort to survive, to allow me to survive a short while. That is a few minutes, a few hours, a few days, or even a week. Does not stack up against the opportunity to just die peacefully. I guess that's it. That does really, it just gripes the tickets out of me, honestly.
Yeah.